Good evening, everyone. Welcome again to a live town hall meeting featuring Mayor Brian M. Arrigo and Dr. Nathalee as they discuss Revere's continuing response to the COVID-19 pandemic. I am this evening's host, Bob Mallon. This is an opportunity for residents to pose their questions directly to the two individuals who are at the forefront of guiding the city's response to COVID-19 and will continue to oversee the next steps as the state loosens some of the restrictions that have been in place since March. To participate in tonight's forum, you may email your questions to covid19@revere.org. That's COVID19@revere.org. Or you can type your questions into the Facebook comment question section. We will get to as many questions as we can during our 1-hour discussions. We will begin tonight's meeting with opening remarks by Mayor Arrigo and then Dr. Nathalee Kong. Mayor Arrigo is first.
Thanks, Bob. Good evening, everyone. And thank you all for tuning in again to our 5th virtual town hall in response to COVID-19. I especially want to start by thanking everyone that has continued to take the measures that we've asked you to take during this really difficult time, and with the ultimate goal of stopping the spread of the virus. And I know that Dr. Kong will share some positive news about what those numbers look like, and the positive news that we're going to hear tonight really wouldn't be possible without all of you doing what we've asked you to do in terms of listening to the regulations and guidelines, and really taking some difficult steps to stop the spread of this virus. You know, for the last several weeks, and it feels like it's been a blink of an eye, but it has been a couple of weeks, about 12 weeks. We've been focused on making sure that the residents are safe, and there have been real kind of phases of this virus and of our response to this virus, and we've been focused on making sure that the city is well positioned to reopen, and that's kind of where we are now. Is we're in the second week of reopening, and we want to make sure that we do that in a responsible manner, and that we listen to the guidelines and the guidance that's being brought down by the state, but then we take that and make sure that it works and is appropriate and customized to the city of Revere's needs. And that's what we've been doing from day one, and we will continue to do that. And so as we kind of finish up, this is almost now the end of the second week of the phased reopening that the governor announced. I know a lot of people are starting to think about what the future looks like with warmer weather. I know I've had a lot of concern about the beach, and obviously the summer months, how the children in the community and the young people in the community can be productive and stay out of trouble. And so what we've been really focused on, and what's been on the top of my mind, is how we support the young folks in the city. And so with knowing and understanding that the young people in our city have not had the normal interactions and the meaningful interactions that they're used to in school. They haven't had the mentors that they're used to being around for the last 12 weeks. And it's not really a great situation for them. So we want to make sure that we're putting a focus on a plan to make sure that we're providing safe activities for the youth, and that we're able to have supervised programming that really works for our families and for young people. So I am excited to kind of talk a little bit about the fact that our Parks and Recreation Department, along with our emergency response team, have been putting a lot of thought and effort into putting a plan together around summer programming, and that'll be coming out pretty soon. And I just want to make a note that our recreation department is, I'm confident in saying, one of the best recreation departments in the Commonwealth. And with the limited resources that they have, they're able to provide incredible programming all throughout the year. And unfortunately, this summer is going to be a little bit of a challenge, and folks may not be able to enjoy the programming that they're used to, and our young people may not be able to enjoy all of the programming that they're used to. But we're going to make sure that we put a great plan together, and I have a lot of confidence and a lot of faith in the staff in Parks and Recreation and in our emergency response team. We will have a great plan put together, but it's not going to look like it has in the past, and that's kind of unfortunate, and really none of our normal practices are we're able to indulge in anymore, and especially that kind of leads me to the beach. Beaches, and I said this last week, that there's usually no better place to enjoy Memorial Day weekend than Revere Beach, and especially with some nice weather. It's one of the most beautiful places to enjoy a nice sunny day. And unfortunately, with the situation that we're in right now, the normal practices and the normal experiences that we're all used to have to change. And so as we work to make sure that the beach is a safe place, and we make sure that we collaborate with our state partners, and continue to try to make sure that the state police are closely monitoring the beach and ensuring that people are social distancing and that traffic is kept moving and people aren't congregating on the beach. We're gonna continue to make sure that and advocate that parking continue to be blocked off as it has been for the last month, and we've been working with the restaurants down the beach as well. Unfortunately, another normal practice for any resident is to get down to Kelly's Roast Beef or go down to Renzo and grab a pizza or roast beef, and that's not able to happen in the way that we're accustomed to. And so for now, the restaurants on the beach will remain curbside pickup only, but we've been in conversation with those folks to come up with some plans, and we've been kind of helping them and asking them to give us some feedback about how they could open up a little bit more and be able to safely provide the great food that they do to the region. So there are a couple of other things I want to just check in about and talk about. One is on local businesses. We've had a real focus on making sure that the small businesses that have been hit really hard have the support that they should, and that we step up to the plate for them. I'm happy to say that we've distributed nearly $200,000 to our small businesses. We've actually been able to expand our mask program so that in the reopening that the governor announced, it's clear that some of the businesses that would be able to reopen would need additional masks or other items, and we've been able to provide those to our businesses, and making sure that folks understand that we're here to support them. And so today we just announced that we will start virtual office hours for our small businesses on a regularly scheduled time. And we're going to be able to provide that in multiple languages as well, which is really important. And so as our businesses reopen and as they come back, which I want to support and we're excited about, we want to make sure that they're able to get back to whatever the new normal looks like. So we've done a lot of great work, and our business response team has been fantastic in terms of engaging the community and making sure that small businesses do see some relief. I want to talk quickly about expanded testing. We have been really focused as we reopen on expanding testing and making sure that all Revere residents can get tested, and we do have the ability for all Revere residents to be tested down in Suffolk Downs. We also are excited to say that we will be expanding into mobile testing, and that will be focused on our seniors to begin with. We want to make sure that people are able to stay safer at home. And so by providing mobile testing to our seniors, we can make sure that they're kind of taken care of. And if they want to get tested, or if they need to get tested, we can be able to provide that. And finally, I want to talk about some of the outreach efforts that we've made to the community and to the residents. And I really just want to highlight some of the things that we've done. And it's really been, again, a real testament to the great folks that work for the city and that have stepped up and volunteered to make these things happen. But we've, in the past several weeks, we've been able to distribute 42,000 masks out to our residents. We've been able to make over 7,000 wellness calls to individuals in the city. We've provided over 100,000 meals between the grab-and-go meals that we provide at Rumney Marsh and the school lunches and school meals that have been provided really from the beginning of this crisis. Thanks to the great work of Dr. Kelly in the Revere Public Schools, we've provided over 100,000 meals to our residents and to children in the city, which is really an incredible number. And we've also made over 1,000 food deliveries to people who were unable to leave home, which again is really a testament to the great work that people have done and the volunteers that we've had. We've had over, I think, 500 people in the city at some point volunteer for our efforts in response to COVID-19. So I just want to recognize that and mention that, and I think it's really important that during all these guidelines and guidance and all these terms like new normal, that the small stories of people that have stepped up to be able to produce numbers like 100,000 meals being given out to our residents, or 1,000 food deliveries being made, is because of the passion that people have for our city and for the people that live in our city. So I think it's really special that we have this incredible team in place serving our residents, and I am certainly incredibly grateful for all of the work that everyone has done. So with that, I will turn it over to Dr. Kong, and I know we're going to get hopefully some good news as the numbers continue the numbers of new cases continue to decline in the city.
Good evening, everyone, and thank you, as always, Mayor, for having me on your town halls. Ruben, if you can put the slides up. I'm going to start, as I usually start, with the same graphs I've been showing since the very beginning. As the Mayor said, this is our 5th town hall, so we've kind of been tracking this together every step of the way. This is a graph showing the new reported cases per day in the state of Massachusetts as a whole, and as you can see, there is some good news. We are continuing to see a downward trend, and it's been coming down since early May. So as we predicted, the peak was sometime in late April, and we've kind of been coming down off that since. Next slide, please. This is the Revere daily case data, and it mirrors pretty much the state of Massachusetts data, not surprisingly. If you just follow the orange line, you'll see that since late April, once we hit the peak, we've been coming down considerably day by day. And we're seeing new case numbers in the teens or maybe even the single digits, which is phenomenal. As the mayor mentioned a few minutes ago, I think not only is it important to see the current numbers for late May, but I think it's also important to appreciate how far we've come. It's been a long it's been 2 to 3 months, and I know some people it feels like it's been 2 to 3 years. But we've definitely come from so far, and we've made a lot of progress together. That's all in part due to everyone out there who has been doing the right thing by staying at home, wearing masks, washing your hands, keeping socially distant. We wouldn't see numbers like this without every single person doing their part. So really kudos to all the residents of Revere for stepping up. Next slide, please, Ruben. As we begin to reopen our city, the fear of a second wave and a potential second shutdown is very real. It's, hopefully it's not going to be that high, but it is very real. But thankfully, the state and the city of Revere are keeping track of many metrics to guide us every step of the way in the reopening process. The metrics are listed here, and you can find all this information as usual on the revere.org/coronavirus website. That's where this screenshot is from. All these parameters here, testing results, deaths, hospitalized patients, etc. We're all going to be monitoring these things actively as we reopen, and we'll see where we are, if we're still trending in the positive direction or not, and that will inform our next steps. All right, everything we do is going to be done in the best public health interest of all of our essential workers, of all of the workers that are coming back online after a 2 to 3 month hiatus. And of course, it's all going to be in the interest of the public and all of our residents at large. Avoiding a second wave, it's going to require doing the same things you all have been doing. And as you can see from the other graphs I've showed, everyone's been doing a great job. We've been seeing fantastic numbers. So we just have to keep it up, continue wearing masks, continue social distancing, practicing hand hygiene. Again, we are always safer at home. Although things are going to reopen, we're all going to be safer at home. And for those who are going to be returning back to the workplace, we are instituting mandatory workplace safety standards. And that is to help keep everyone who is going to go back to work safe from getting the virus. And it's also going to mitigate against the second wave we keep talking about. All right. So again, as each phase of reopening moves forward, we'll continue to assess all of these numbers. Obviously, knowing how many new daily positive cases we have is incredibly important, but there are other metrics that you can see here that we're going to weigh those numbers against, and it's all kind of a balance. We want to make sure we have contact tracers who are at the ready. We want to make sure we have enough hospital beds to care for any patients who get the coronavirus. So all these things are going to be actively monitored and will inform our decision every step of the way, so that in the end, everyone stays as safe as possible. So as always, we're all in this together. Next slide, please, Ruben. As the mayor mentioned as well, testing continues to remain at the heart of battling this virus. Testing, tracing, and isolating will continue to see us through this pandemic until effective treatments and vaccines can be created. So I just want to take a minute to make sure that everyone knows of the testing capacity that the city has. As always, all the stuff can be found on the revere.org coronavirus site. We have testing available to all residents, regardless of whether you have symptoms or not, and regardless of your insurance status. That is available 7 days a week at East Boston Neighborhood Health Center. Beth Israel and Chelsea and the MGH in Chelsea still have their COVID testing sites up and running for both walk-in and drive-in and also by appointment testing. So that remains available to everyone. And as the mayor also said, to complement our reopening phase, we are going to start mobile testing for our elderly population who may not be able to leave and go to these testing sites or drive to these testing sites as easily as others. Let's see. And next slide, please, Ruben. Last slide. Finally, in addition to testing, I just want to continue to put a plug in for our contact tracing team and our contact tracing collaborative. In addition to Carol Donovan, our public health nurse, the CTC, which is run by the state, continues to make very important, very vital phone calls to all patients who have tested positive for the coronavirus. It is so important that you pick up these calls, because as we reopen, as more people are leaving their homes to go to work or to try to get some fresh air and try to enjoy the summertime with their family, we may see an increase in cases. And that means we have to make sure we get everyone tested quickly and, more importantly, isolated quickly so that this virus doesn't continue to spread. There are the state has even introduced new guidelines on testing close contacts, so like family members of patients who may test positive. So just make sure you pick up the call, because our contact tracers will always be able to help you and guide you in making sure your family members are also getting tested and also staying safe. And as always, we have these contact tracers in a number of languages, so language should not be a barrier to picking up the phone at all. I think that's all I have on my end. Pretty short for today, but just kind of to piggyback on what the mayor said, it's been a long 3 months for us all, and as summer is well at our doorstep now, I just want to to take a minute to thank everyone and to encourage everyone to try to keep this up as much as possible. This is the new normal for now, but I'm confident that it's not going to be forever. I'm confident that we are going to have great treatments and a vaccine coming down the pipeline. And just to kind of echo that, everyone, I think, has been really stepping up, from all the folks who have volunteered to give out the food, to all those who volunteered to deliver food, and to all the healthcare workers and the other leaders in the city who really stepped up to make this new normal as I guess manageable as possible for the rest of us. I think we're going to continue to learn from each other and continue to hopefully do right by each other. So onwards and upwards.
Thank you, Dr. Kong.
Thank you, Dr. Kong and Mayor Arrigo. We'll start with some of the questions that have been submitted via email. Many of the questions involve the circumstances down the beach. And Mayor, they range in people who want the parking to remain prohibited to people who are complaining that the prohibited parking is causing overflow problems as visitors to the beach spill over into the neighborhoods near the beach. Can you comment on how the city is working to try and deal with the problems down the beach that are resulting from the no parking order?
Yeah, and I know that the Point of Pines neighborhood has also been impacted by some folks who have decided to descend upon the neighborhood and try to get down to the beach that way. And so I'm actually planning a conversation with the Beach Association, the Point of Pines Beach Association, but we've been in constant contact with our state partners to make sure that it's safe. My opinion right now is that the parking on the boulevard and the parking restrictions that have been in place have to remain in place to prevent people from continuing to think that this is just another normal summer. And that's really going to be one of the only ways that we can prevent people from really descending upon the beach on a nice day and causing a real problem for our city. If you look at, we did a little press conference on the beach the Friday before Memorial Day, just to make sure that people understood the importance of staying home. Certainly if they're going to go to the beach, that they wear a mask and engage in social distancing. But that day, it was a beautiful Friday afternoon. We were down there, and I have to say that it was probably one of the first days that was in the 80 degree range, I made a comment to a couple of the state troopers that were there that day, in any normal circumstance, you take the Friday before Memorial Day, the beach would have had so many more people on it, it's usually coincides with a senior skip day or some kind of day that all the kids decide to not go to class because it's a beautiful day out, and and usually it's a lot busier and a lot more packed. And although there were still a lot of people on the beach, it wasn't as packed as it normally is. And so I guess in some ways that's our new normal. And we have to do things, and I have to make sure that I'm making decisions that put public health first. And so if you look at something like the parking down the beach, if we allow people to park on the beach as we normally would, I think you see a lot more people down there. You see a lot more people, not engaging in social distancing. You see a lot more people not wearing masks, and it would be a lot scarier of a place to be. With that said, I also know that other beaches are starting to think about how to lift their restrictions, and I know up in Lynn and Nahat that may be happening soon. And what I would tell anyone who wants to drive to Revere Beach and can't get a parking spot, that they can go a little bit north and go up to Nahat if they want to, or they can go. There are a lot of other beaches in the region that we want them to enjoy. But for now, I still think it's important for us to continue to have those parking restrictions in place. And with that said, I also want to go back to something that I talked a little bit about in terms of the restaurants on the beach. We are working, as I said earlier in my kind of opening, that we're working with the restaurants on the beach to start to be able to do a little bit of additional service, and we know that's going to create larger crowds. And so, if I were to open up the parking and allow folks to continue business, the restaurants to continue business as usual, I think that would be a real recipe for disaster. So we're trying to take a measured approach and try to make sure that we're doing things that keep the community safe and healthy.
Thank you, Mayor Arrigo. The next question involves the recreational facilities in the city, such as playgrounds. And in one respect, they ask, when will these be open? And from a medical perspective, I guess this question would be directed, or this aspect of the question would be directed to Dr. Kong. How safe is it for children to be interacting, at a playground?
Yeah, so I'll just jump in really quickly on the facilities. I mentioned again in my opening that our recreation team has been working on the programming. Mike Hinojosa, the director of recreational parks and recreation, we've been working on a plan for our facilities to have a phased opening of certain parks and playgrounds, and make sure that there are the necessary kind of required guidelines in place for those to open back up. I would ask people to be looking out for some more information about that. Probably in the next few days, we will be kind of talking about what that looks like, and what kind of restrictions we'll have around our facilities. And Dr. Khan can maybe talk a little bit about some of the health risks around that. But we want to make sure, again, we're always trying to put, and we always are putting public health first. And so we understand that the youth in our community are getting antsy. That folks want to get to be able to play basketball again. I noticed that at Wayland School the other day that somebody had taken some of the the material that we put over the rims to prevent people from playing, that it's been ripped off, and I don't know how somebody got up and did that 10 feet up in the air, but they did. But we understand that people are getting antsy, and we want to make sure that the recreational spaces that we have are safe, and we're going to be guided again by our medical expertise on that.
Yeah, I think it's always a tough decision to make. Public health and putting public health first oftentimes means making really tough decisions that may not be the most popular decisions, but I think that's kind of what we're up against now as we continue this phase reopening. Regarding the safety of parks, I think as long as certain safety measures are met, like if there's a way to clean some of the things that are used, like the high touch surfaces that are used in the parks, that's kind of one very obvious way to start. But as long as it's hard for kids because they come in. There's a wide age range, and there's definitely an age range where we don't wear masks and an age range where we do. So I think where your child is able to wear a mask and keep it on, that's obviously going to be best to make sure the virus isn't spreading, and to make sure, more importantly, that they're not touching these high touch surfaces and then touching your eyes or nose or mouth, because that's how you can inoculate yourself with the virus. So I think as long as we're using the same type of common sense foundations that we have been using regarding disinfecting high touch surfaces, wearing a mask where it's appropriate and where it's age appropriate, trying to social distance as best as possible, though again that can be hard with children of some age groups, and especially if they haven't played with their friends in so long. And then the other thing too is to potentially some unique solution would be to install more hand washing stations in the area too, so that folks can always be close to some receptacle where they can wash their hands. I think that would encourage hand hygiene too, and kind of help make those parks less of a hotspot for infection. But it's a really tough question to answer and a tough balance to achieve, because I do understand why folks are so looking forward to parks reopening, and I am totally in that same boat. But it has to be balanced with just, how can we just use our usual foundation of keeping folks safe, and how can we apply that to children playing in a park where there could be a number of kids, and that may mean there has to be like a limit. Just like there's a capacity limit to our grocery stores and our restaurants, there may need to be a capacity limit too, so that social distancing is still achievable in those spaces. So I think more to come. The discussion is obviously ongoing, but I think those are just the start of how parents can keep their kids safe when parks do reopen. Is just the same things you've always been doing, and wherever we can provide hand washing stations or capacity limits or disinfecting supplies, that's what we'll do. And I imagine the gyms will be the same way too, where you have high touch equipment like that, and where disinfecting protocols need to be ramped up.
Thank you, Dr. Kong. Mayor Arrigo, this question asks whether you have had any feedback or comment on how successful the first weekend of having places of worship be open in the city, whether there are any issues with that, or whether you've had any feedback from the religious community.
Yeah, we reached out when the governor announced that houses of worship would be able to reopen, and what that would look like. A few churches in the community were ready to go and interested in opening up, and they wanted to get our kind of I don't want to use the word blessing, but they wanted to know where we stood on that. We've been in I've been in regular communication with our faith leaders through this whole process, and I know that some churches did open up for service, and I haven't heard too many complaints about that, which is good. We were able to provide a couple of houses of worship with masks, with additional information, some educational information for the parishioners. so that folks could understand really what why these measures were being put in place, and what to expect when they do come in and pray and are able to kind of find some solace in a place of worship. So, I guess the short answer is that we haven't heard too many complaints about it. Like I said, I have regular communication with folks, and we've in our religious sectors, and we've been able to, I think, have a good relationship in terms of making sure that we're supporting them in what they do, and support them with the information that we get and the guidelines that we could provide to make it safe for people to practice their religion.
Thank you, Mayor Arrigo. Dr. Kong, questions have come in once again. This seems to be a recurring topic, and that is regarding testing. Can you address the availability of testing? And one in particular indicated that she is immobile, does not have a car, and is mostly confined to her home, and what type of testing options would be available to someone in that situation?
Yeah, so for anyone who feels like they could have symptoms of coronavirus, first and foremost, I always urge you to reach out to your PCP if you have one. Every healthcare system, whether it's the BI or Beth Israel, MGH, CHA, East Boston, they all have their different protocols for getting their patients quickly and efficiently tested. And even more importantly, they all have protocols on getting in touch with patients after they got tested. Even if they tested negative, we're always making check-in calls to make sure patients aren't getting worse, and make sure they don't have a false negative, and that they are getting sicker. So that is definitely the route I would take first. But for those who either can't get in touch with their PCP or don't have one, East Boston Neighborhood Health Center remains a great option, as well as the Beth Israel Clinic in Chelsea and the MGH Clinic in Chelsea. Those are the closest testing sites to the city of Revere that are offering testing for any patients, regardless of if they have a PCP, who their PCP is. If it's not in their system, you don't need insurance, and you will never be asked about your immigration status. Appointments are always appreciated, but you don't need an appointment for any of those. And all of this information can be found on the revere.org/coronavirus website. For folks who have a hard time leaving their home, if they're, for whatever reason, bedbound, or if they're concerned that they may have coronavirus because of symptoms that are displaying, again, reach out to your PCP. A number of health systems have a way to get EMS out to the home for mobile testing. And as the mayor mentioned, we are finalizing mobile testing that will be available to seniors in need. So I encourage that person to reach out to their PCP if they have one, to see if we have testing available, a mobile testing option available for them, because we have been working with Fallon EMS and a number of other ambulance companies to dispatch them to various residents and get patients who have mobility issues tested quickly and efficiently.
Thank you, Dr. Kong. This is probably most directed to Mayor Arrigo. We're reading a lot about the possibility of outdoor dining as restaurants begin to open. Does the city of Revere have any plans or expectations regarding outdoor dining?
Yeah, that's a great question, and we do expect there to be some announcement pretty soon about restaurants and about dining in general. But our business response team, has been working really closely with some of the restaurants in our community to start to get them to think about public spaces in different way. And so if you think about streets and sidewalks, this really gives us an opportunity to have additional outdoor seating options, and maybe maybe we come up with some concepts that become more permanent or longer lasting through maybe not just the summer, but through the fall and maybe maybe even into the winter. So I'm all in on making sure that we have spaces and we think creatively and kind of innovate a little bit about how we use spaces. I'm in my office right now, and I can look across the street to De Parma, and I know it's a busy corner, but I can imagine additional space being out on either Broadway or Yeaman Street in a safe way. We could be able to have additional seating out there, and same goes for the American Legion lawn right out front as well. Trying to think about these spaces creatively will be really important for our small business community, especially our restaurants. And then, of course, you have the beach and you have the sidewalks along the beach, which are a little bit different. We have to think a little bit more. We have to be a little bit more thoughtful about the details of that. But I certainly support using sidewalks and streets in a more creative way, and even thinking about how to block off certain parking spaces. Maybe we remove some parking spaces and allow additional seating to happen in little parklets. And so I think we also have a great team in our business response group that will make sure that we come up with some really creative and thoughtful ideas. And I know we had one restaurant that did a movie night, and we've learned a little bit from that. I think we're going to have to be creative, and we're going to have to help. Our businesses be creative about how they can sustain their business and kind of take advantage of the nice weather that we have. We certainly want to do that. So yeah, I'm in favor of it. I think there are some really exciting things that can come out of it, and probably some policies that will last a lot longer. One other thing that people are talking about, and this is above me on the state level, but making sure that even beverage consumption can happen on those sidewalks and in those public areas. There's a lot of red tape that comes along with that. And so being able to provide that will also help the small businesses and the restaurants in our business district. So when you think about Broadway, or think about Shirley Ave, even think about spaces like the Central Ave parking lot, there are some really creative things that we can do. And we have an opportunity to think outside the box. And I like being in that space. So we'll be supportive of those ideas. And I think there'll be a lot more to come, and it'll be probably pretty exciting for some people to see some different things happening like that.
Thank you, Mayor Arrigo. This is a medically based question, and it deals, Dr. Khan, mostly with the statistics that you alluded to during your opening. It is said that Revere has a very high rate of positive tests. Is that continuing? Why do you think that's so, and what is being done about it?
Yeah, so Revere was at one point during the pandemic, we had a pretty high rate of positive per 100,000 folks. So for a city of our density, we did have a high rate of positive tests. Thankfully, that has, I think, calmed down a little bit. We have a new dashboard on revere.org/coronavirus. Thanks for putting it up, where we have this among many other types of graphs so that you can kind of see where our city lands compared to many other cities of our size, or even cities that are greater in size than us, like Boston, for example. We were much closer to Chelsea at one point, but those numbers have gone down, and this is expected. As you're testing more people, your numbers are going to change. Your graphs, everything is going to change because your denominator changes. This basically, it comes down to, I don't want to bore people with a math lesson, but this kind of comes down to a math lesson where the more people you test, hopefully the lower your percent positive ends up being. And that's a good thing because we always want to test more people. We don't want to be testing less people. The more people we test, the better. So our high positivity rate in the beginning just told me that we weren't testing enough. And a lot of that had to do with things outside of our control, like our capacity to test. Early on in the pandemic, we were still ramping up our laboratories. Before, it was just the state laboratory, one place in the whole city testing everything. And now we have many, many centers running the test, like Quest Diagnostics, which is one of the biggest labs in the country. So that had something to do with it. We have a lot more test kits, thankfully. We have a lot more places where we can test. We've developed mobile testing sites, drive-in testing sites, drive-through, walk-through, bike-through testing sites. So as you get more of your population tested, it's only natural that you start to see that number go down. The other thing I want folks to keep in mind too is that we've also begun to test asymptomatic individuals at East Boston Neighborhood Health Center. So those individuals may have also contributed to that number coming down because they added to the total number of tests, but thankfully a portion of them probably weren't positive. So I think those numbers are to me reassuring, because if we're seeing a trend of tests, percent positive tests coming down, that just means that we're increasing our testing capacity to meet the needs of better.
Following up on that, Doctor, you mentioned the testing of non-symptomatic individuals. The question basically is, would it make sense to have mobile testing at popular areas such as the beach or parks where people tend to be going?
Yeah, I had mentioned this briefly in the last town hall meeting. I'm all for asymptomatic testing if you have a high pre-test probability of potentially being positive. So, for example, if you are a close contact of someone who is known to be positive, for instance, a family member that you live with, you are most likely, you have been exposed to that person and you could very well have it. We do know that a number of patients with coronavirus can shed the virus prior to developing symptoms, or they may be these like asymptomatic shedders. So I think it's important to ensure that these folks do get tested because they were in close proximity to someone who did test positive. Their odds of testing positive are pretty high because of the scenario that we're discussing. What I don't want is for people to have a false sense of security when they do test negative. A negative test is just a data point in one point in time. So you could get tested on Tuesday at 5 p.m. and you can walk out of that testing center at 5:01 and someone could sneeze in your face and you could get tested. You could get the coronavirus, but the test will read negative because that happened after you got the test. So I don't know if it is worth the effort to test all folks at popular sites like the beach or like restaurants. I think the best thing we can do in the fight against coronavirus is always preventing yourselves from getting it in the first place, because our testing capacity is not a panacea. It's not it's not like our little magic wand to unfortunately allow us to reopen and live life the way we want, or live the summer the way we want to live. So I'm always a little bit hesitant to do widespread testing, because that just gives us one moment in time, and I don't want folks to think of it as a get out of jail free card. Having said that, though, I do believe that we need to test early and often. So if you are having symptoms, if you did come in close contact, or if you just need to be confirmed negative before going to work, I think those are all legitimate reasons to get tests, even if you don't have symptoms. So I hope folks out there aren't refraining or afraid of getting a test for whatever reason, because we have the ability for all Revere residents to get tested if they want to. So that should never be the hold up to getting tested. But I just don't want to just say, hey, everyone in the beach should get tested, but then they could definitely get it, a minute later, 5 minutes later, 2 days later. It's just not going to be something that will tell us what is going on or what's going to happen to that person in the future.
Thank you, Dr. Kong. Mayor Arrigo, this question involves restaurants that sort of fall in between the restaurants that remain closed and the restaurants that have takeout. And the reference is to places down the beach, but it probably would apply to any restaurant that has kind of takeout, walk up, grab and go takeout service. And that is, what are your current plans, or what are the city's current plans to deal with restaurants such as that?
Yeah, so we've actually been in touch with, especially the restaurants on the beach that do that, and especially with the nice weather. I certainly am sympathetic to the fact that folks feel like their prime time and their season is really they may be losing some days in terms of the ability for them to operate at a full capacity. But right now, we have been working with those restaurants down the beach that are kind of grab and go. And I use Kelly's as the example, but there are a number of them along the beach. And we've been asking them to present us with a plan that we can feel comfortable with, and we can review, and we can make sure that they can implement. And if they can implement it, we will allow that to happen. But with the caveat that if one of the 53,000 inspectors that we have in our community, if somebody snaps a picture and we see, we see something that is a public health hazard, we're going to take action on that. So again, this is about responsibly reopening, right? And getting back to, I don't want to say getting back to normal, because I don't think we're ever going to get back to normal, but getting back to some semblance of what that was, and being safe as we do it. So we want to put it on the businesses to come up with the plans and kind of allow us to vet them and make sure that they are up to the standards that we have. And those conversations have been really, really positive. And I think, again, this is giving everybody, and really kind of in every sense of the term, we're having the opportunity to innovate and think differently about how we operate, whether it's a restaurant, whether it's a city, or if it's a retail operation. People are going to have to adapt and think creatively and innovate, and we want to promote that, and we want to support that. So we have had really positive conversations with those restaurants, and we'll continue to, and I think we'll see some action soon around the city allowing expanded service, especially down the beach.
Thank you, Mayor Arrigo. Dr. Khan, question for you. What should a person do who has other medical conditions but is reluctant to go visit their doctor?
So, great question. I actually think that folks with like other medical conditions who need to see their doctor regularly should continue to contact their doctor. This has been something that we've been talking about a lot at MGH and in the medical community over the past 3 months, is that when the coronavirus hit and when we had to grind our clinical practices to a halt, we also saw a reduction in the number of ED visits for chest pain and other pretty common reasons to come to the ED, which really shouldn't be. I mean, the number of folks who have heart disease didn't just disappear when the coronavirus came. So that's a concern that a lot of doctors at MGH had, is where are these folks going, and are they suffering in silence? So no one should be suffering in silence. Just as the mayor mentioned, as we are thinking of innovative ways to reopen our community and to find a new happy normal, the medical community has done the same, in that, myself as a primary care provider at the Riviera Health Center, we are 100% up and running with telemedicine visits. And now those can either be phone-based visits Or we even have a number of platforms like Zoom to use so that we can see our patients. So if someone has a rash, I can see the rash. If they have a swollen knee, I can see it. They can just point the camera at it. So it's been a great way for me to continue to provide the standard of care that I normally would give to all of my patients. And it allows them to get that care without having to leave their home and come into a waiting room to expose themselves, especially those with conditions we worry about if they were to get COVID. So that has been our innovative solution for delivering primary care during the time of this pandemic. So I would encourage folks to continue to call their doctor, reach out to their doctor. Don't just sit and suffer in silence, and don't let these chronic illnesses that you have that otherwise would be well managed, don't just let it kind of fall by the wayside. We are here for you, and we're here to help you. So
we probably have time for one last question. Dr. Kong, this harkens back to, you mentioned a vaccine at the outset. What do you understand to be the status of vaccine research?
Yeah, so there are a lot, as you can imagine, there are a lot of places around the world that are working on creating a vaccine. I think there is some news about one particular company that was going on to phase 2 clinical trials. The main thing about vaccines is that we have to first prove that they're safe. So you want to make sure that nothing bad is going to happen to anyone that we give the vaccine to, especially in a vaccine that is going to have such widespread administration like the coronavirus. I mean, you can imagine a huge majority of folks in America, and if not the world, is going to want this. So the first thing is to make sure that it's safe. Before we even dive into the antibody response and other kind of technical things, you also want to make sure it's safe. And I think that's where we're at right now. Hopefully we will continue to see progress. I've heard about some progress, slow but steady progress, and hopefully sometime in the coming months, probably not till 2021, but I don't want to be a Debbie Downer, so fingers crossed that it's earlier. But that's kind of all I've heard. I actually haven't heard too much about it, so I don't have a lot of details for you, unfortunately, but I know that there are a lot of people thinking about this problem. So I think all the bright minds in this country are working on it. So I have faith.
That's good to hear. We're coming up on the 7 o'clock hour, so without any further questions that are available, we'll let both speakers give their final thoughts on the status of COVID-19 in the city of Revere. Dr. Kong, would you like to start?
Sure. I think kind of as we have been mentioning all along, the numbers are looking good, but it's not a time to rest on our laurels. We don't want to kind of mess it up in the fourth quarter. So I think everyone just keep your chin up and do all the right things that you have been doing. I know the sacrifices that many have made is immeasurable and cannot be overstated. And I hate having to come to you all every 2 weeks and keep on doing the same thing that you're doing. But trust me when I say that it's working, and it's not for nothing. It's going to be hard to do that over the summer. I know no one likes to wear a mask when it's really hot out. I definitely don't enjoy walking my dog with a mask on, but it is the only way we're going to be able to keep each other and ourselves safe. So hopefully we can just continue to keep our heads up, and hopefully we'll continue to work alongside the residents of Revere to come up with innovative, creative solutions to make this as fun of a summer as we possibly can. And that's it.
And Arrigo, would you like to wrap up?
Yeah, sure. And thank you, Dr. Kong. I think you hit the nail on the head when you talked about the sacrifices that folks have made, and that we have seen the difference that's been made by the actions that people have taken. The chart that you showed that showed where we were and how we've kind of flattened that curve out really does show that the actions that people have taken haven't been in vain, and that they've actually made a difference. So I'm going to end by just thanking everybody for their sacrifices, and just ask them to please continue to do your part. I know it's difficult. As Dr. Kong said, it's not a lot of fun to be out in this beautiful weather wearing a mask, but I think those are important things that we have to continue to do and we'll continue to see the progress that we've made if we continue to take those actions. So again, I just want to thank everyone for their time, for checking in, listening to our updates. We'll be back in a couple of weeks, and if there's some big news, we'll be back maybe before then. But again, I want to thank everyone for taking the actions that they've taken. I certainly appreciate it, and it has helped us slow the spread of this virus. And I want to thank Bob for being a great moderator, and I finally want to thank Ruben for not screwing it up this time and making sure that everything went off without a hitch. I kid because we had a little bit of technical difficulties a couple of days ago, but we're back and operating at full steam. So thanks again for everyone for watching, and we really appreciate the feedback and appreciate being here and being able to hear your questions and concerns.
Thank you, Dr. Kong, and thank you, Mayor Arrigo, and thanks to everybody for participating in tonight's forum. You can get continuous updates on the city's COVID-19 response at the city's website, www.revere.org/coronavirus. If you have any particular questions, you can always contact Revere 311. It is operating with expanded hours Monday to Thursday, 7:30 a.m. to 6 p.m., Friday, 7:30 a.m. to 3 p.m., Saturdays and Sundays, 8 a.m. to 5 p.m. All emergency questions related to COVID-19 can come through the office by phone, email, mobile app, or web request. Good night, everybody. That concludes tonight's forum.